Right now, though, let us talk to our good friend, Professor Karol Sikora, because, of course, Rutherford Cancer Care is an organisation he's been associated with for quite a long time. He's got some good news for us on the front of what he said a while ago to us, that there were some cancer care sort of centres which were pretty much lying dormant and weren't being used by the NHS, and he was hopeful that they could become active again. And I think he's going to be telling us now that that has exactly happened. Professor Karol, a very good afternoon to you.
Good afternoon, Mike.
So, I mean, you and I, good to see you. You and I spoke about this a little while ago, and you were saying, wouldn't it be good if these centres could be used by the NHS? So what can you tell us?
Fantastic news from Liverpool. The centre there, which is beautiful, has 2 linear accelerators, radiotherapy machines, state-of-the-art, an MRI scanner, a CT scanner, and a beautiful clinic area, has been bought by the NHS locally and tied into this cancer centre, which is only 100 yards down the road,
Brilliant.
Which is hopelessly undercapacitated. So this really will help the people of Liverpool tremendously.
Right, so this can move the sort of the waiting list along, hopefully.
It has, and the thing about Liverpool, it has no proton facility, and that's what the central management of the NHS don't want. They don't want to let protons out of the ration box. It's a type of radiotherapy that's more precise. And so the other 3 centres which do have proton facilities are still languishing, empty. They can be opened within a week. And, you know, we still have a huge backlog in cancer, as you know, we've talked about this. And it's just so difficult to somehow grasp it. Right. And hopefully we'll get there. There's plenty of people with money that will put it in to do what's called a public-private partnership. So the NHS uses part of it, private sector uses another part, and overseas patients can come as well. So the whole thing balances out to the money men who are vital for all this. But it's just so slow, and I can't believe it'll be a year in June that everything's shut.
Yes, it's interesting, isn't it? Because, I mean, you and I probably spoke maybe 6 months ago about this, and it doesn't seem like yesterday, to be honest, but the time has flown so much in recent times. And maybe this is also a good sign of perhaps the NHS being a bit lateral thinking, you know, because we could see lots of partnerships that they could do in situations perhaps with dental work, with GP surgeries, all manner of things. And I mean, you'll get no doubt people complaining that, oh, it's all about selling off the NHS. It's really not. It's just about dealing with medicine in a more grown-up kind of 21st century way, isn't it?
Exactly. And, you know, if you look at other countries, I've recently visited South Africa, 38 cancer centres owned by a group called ICON, totally private sector. All the patients there, or the majority of patients, they're not private patients, they're government patients going under contract, under the government insurance scheme. All countries in the civilized part of the world have some sort of universality. By that I mean everyone is covered for some level of healthcare. Right. The problem here is that we want the NHS, the public sector, to deliver it, as not the private sector. You know, if you needed an operation tomorrow, you wouldn't care whether you went to a public or a private hospital. You might rather like to go to the private hospital where there's wine with you at dinner, for example.
Well, indeed. And tell us about this proton treatment, because it's not available generally on the NHS, is it?
No, this is really a bit of a national scandal. I was involved way back 20 years ago in the planning for it. There were going to be 4 centres paid by the government. It got reduced to 2, Manchester and UCLH in London. And, you know, the number of patients going through a fraction of what should be going through. We're treating less than 1% of all radiotherapy patients with protons. The number should be 10%. Everybody knows it. Other countries are doing it. Spain has just ordered 11 proton beam machines to get up to speed. France, Germany are all far ahead of us. And it will get there in the end, but it takes so long. And the trouble is the bureaucracy is really killing innovation within the NHS.
Yes, and I'm reading a story in the Times this morning, Karol, in which it says the NHS must scrap unnecessary appointments for cancer patients to speed up treatment. And this is a report that's come from various health leaders and basically cancer doctors saying that, you know, there's an awful lot of red tape, which doesn't surprise me when it comes to treating cancer.
Absolutely. I mean, it's a bit of a surprise it came out this morning, but it's true. Booking people in for unnecessary appointments costs money as well as wasting their time. And, in most countries, you'd get sorted out in a day. You'd have all your tests done the same. You'd take a good book, and by the end of the day, you'll have the results.
Right. Oh, I think we've just slightly frozen there. The report I'm talking about here is a paper led by the Evoke Incisive Health Organisation, commissioned actually by AstraZeneca. The Times managed to get their hand on it. They said that there are short-term practical steps that could unlock extra capacity in NHS cancer services. Unnecessary appointments are costly, occupy scarce clinical time and are stressful for patients. And, I mean, one of the things we talked about, Karol, the other day was Martina Navratilova gave an interview to Piers Morgan, which we watched here on talkTV, and talking to some people afterwards, we were sort of saying, well, in a way, she's fortunate that she had those cancers. She had two different kinds of cancers in two different parts of her body, that it happened in America, because American outcomes are still an awful lot better than ours, aren't they?
They are, and it's mainly due to delay in diagnosis and getting on with treatment. So pointless tests, pointless waiting. I mean, it's like Heathrow on a bank holiday in the NHS sometimes. You've got a series of tests and there's a series of queues, and they're sequential. You can't go through one queue and get out the other side. You have to wait, going through security, going through passport control, all this sort of stuff. And eventually you get through and you get started on treatment. The target here is 62 days from diagnosis to treatment. You'd sue if you were in the States, if someone said, you wait 2 months before you can have treatment. And no one seems to take it to heed.
No, and this is one of the problems with this sort of waiting list situation, isn't it? Because an awful lot of people are waiting to see an NHS doctor for some kind of procedure, not necessarily cancer. But there's actually more people waiting for the second appointment, having had one, and then being referred elsewhere. And I'm told there's like 10 million on that list. And many of those will have cancer.
And 10 million is nearly a sixth of the population of the UK, which is amazing statistic.
It really is. And I mean, I know this is a very small step, but I mean, hopefully in that particular area, if you live in that area, you will be a lot quicker getting through the system. Will they be able to import people, as it were? You say they'll have some patients from overseas. Would they be able to take patients from, say, London or from Manchester or anything like that?
I suspect for diagnostic tests, no, but for treatment, yes. And I think what we've got to look at, there are 60 places you can have all forms of cancer treatment within the NHS. Let's look at which are doing it faster, where the waiting lists are less. Just like driving tests, people select the driving test centre where they can get it sooner, even if it's the other end of the country. Why not cancer treatment? I wouldn't mind staying in a hotel for 4 weeks if I could be treated next week.
Yes.
And many people would feel like that.
Yeah, absolutely right, because it is literally life or death. Karol, thank you very much indeed for talking to us. Professor Karol Sikora, Medical Director there at Rutherford Cancer Centres, one of them in Liverpool, now going to be available for NHS use, which is a good piece of news, it has to be said.